I'm a CPAP consultant at Res Sleep, so that's a sleep apnea clinic. Also trained as a diagnostic technician, and I'm the team leader there at the moment. So, the main aspect of my role as a CPAP consultant is involved in the treatment of patients who come to us with obstructive sleep apnea. So this is a condition when they stop breathing throughout the night. As a result, they can be quite tired and fatigued throughout the day, and they're just not getting the right sleep at night. So they come to us with a problem, and I'm involved in the treatment of that. So using CPAP machines, which is basically a medical device that sits on their bedside table, and they wear a mask every night to bed. So the main thing I do on a daily basis is I'm involved in appointments with these patients, so they'll either be trialling, they'll be starting the trial, which goes for 1 month, or they might be on trial at the moment, or maybe they might be finishing up. So kind of working with patients who are all at different stages of this journey, because it is quite a journey that happens throughout the month, and I'm also involved, I guess, with the walk-in side of things. So we have people come in off the street sometimes. So there's a bit of education there where we're giving patients the right knowledge to know about the process and the treatment. And usually that's involved. Usually, if they're educated, there'll be a successful outcome, and everyone's happy. A typical day in my workplace is mainly involved in these appointments with patients, but I wouldn't say that any 2 days are the same, because every patient is totally different. So people come to us and undergo quite a change throughout the month. Some people find it a lot easier than others, and obviously everyone's different, they all take to it differently. So I'm involved with the support side of things as they go through using these devices. The best part about my job is seeing the transformation that people go through during the month. So it's really quite rewarding for me to be able to help patients, and this assistance is quite obvious most of the time. People come to me with quite a serious problem sometimes. They'll stop breathing 100 times per hour throughout the night. That's as serious as it can get. And you can imagine the way that these people conduct themselves on a daily basis. So even when they first come into the clinic, it's quite obvious that they've got this problem. They'll be falling asleep in their chairs in the waiting room. When I'm trying to show them how to use the device, their concentration is really poor, and you can tell they're not really actually there. Sometimes you can actually see a physical, you can see it on their faces, so the way that their eyes look. So when they go from stopping breathing 100 times, and then after maybe 2 weeks you've got them established, they're using it every night, and they're comfortable with the mask that they're wearing as well. When they come back to me for our appointment, they'll just tell me about how amazing they feel, and it's quite rewarding to hear that side of their story and to see the change that they go through. We can go from 100 times per hour all the way down to 1 using the machine. So it's just this massive improvement, and it can happen quite quickly for some, whereas others it can take time. The other side of it that's also really rewarding is when you have the partners come in with the patient. So you can imagine that when this patient has this problem, they're getting up frequently throughout the night, they're snoring really loudly, and it can be quite disruptive to their bed partner as well. So I have the partners come in and they thank me and they say that I've changed their life as well. So it's really good to see such good outcomes on a daily basis. So I'm really lucky to have that. The main skill that I use on a daily basis is definitely interpersonal skills. As I've kind of touched on, patients are very different. So everyone comes to me and they'll present differently, they'll react differently to the treatment. So I need to be able to, understand what they need and go with that. Some people find it really easy to use the treatment, and they come to me just to have a good old chat about their day, and maybe they're using the appointment as a good way to escape from work on 3 o'clock on a Friday afternoon. So I need to be able to kind of pick up on that and go with what they want, because at the end of the day, this is about them. And then there's other patients who need more emotional support, so they can get quite teary during an initial consultation because they're horrified at the thought of a mask on their face. What's their partner going to think of them? All of that's going in through their heads. So I need to be able to assess that situation and provide the support that they need. The other thing that I find really useful is, the technical side of things. So I need to be able to understand everything about these machines. I'm always asking our representatives more questions, particularly when I might have a patient come up with something interesting. I don't know the answer. I'm always going to find out the answer, because the more I understand, the easier it is for me to pass on the information that the patients need to them. So I also, need to pick up on how much information the patient should know. So we have elderly patients come in and they really don't want to know anything else except for how to press the button on and off, versus a young engineer who wants to know every little detail about the machine. So usually I'll look at their occupation and kind of graft my I'll figure out how I'm going to approach this patient during the month. I think that's probably the main two things. The most challenging thing about my role would be when patients come with a mental block. So they already might know a little bit about the device, but they've already made up their mind that they aren't interested in the therapy, and they're just there because their GP told them that they need to get treatment or their partner forced them to do it. So when patients come in and they've already decided that they're not going to enjoy the therapy, sometimes there can be a bit of anger, and trying to diffuse that can be really quite difficult. But in saying that, when you can turn these patients around, it then becomes the most rewarding aspect of my role. So it's not all bad. When that does happen, I kind of like viewing that as a challenge, and trying to turn it around so that I can give them the best out of their treatment as well. Leaving high school, all I knew is that I was interested in the human body. So I chose biomedical science, because it was such a broad overview of everything to do with the human body. So I was right in choosing that. I was really interested in all my subjects going through, and I was a sleep technician. I actually started that job while I was still at university. I had the right knowledge to kind of go through that process, even though I didn't need a degree to start that. So I think I was a little bit lucky in that regards, being able to take on that role, because it did set me up quite well for where I am now. I did that for a year or so, and then I took a job selling scientific instrumentation. So that was a pretty big change. It wasn't actually anything to do with the human body, but that was probably one of the most challenging parts, was picking up knowledge about something entirely new. But in saying that, I did learn so much, and I think a key part of that was actually the sales side of things. And then I kind of missed the patient side of things and the clinical side, so I decided to go back into the field of sleep. But rather than doing the night shift work and the more technical side of things, I decided to go into the role where it's daytime work, it's clinical, but also involving sales as well. So it was kind of like the merge of both previous jobs. The right skills was gained from those and gave me the right path into the CPAP consultant role that I'm in today. Coming out of university, when you're in biomedical science, you're kind of confronted with either the two main career options of medicine and research. So as I was going through, I had a lot of friends who were choosing those paths, but for me, wasn't particularly interested in that side of things. So I was actively looking around for what else I could do. I found sleep, and I just find it really, really interesting. It's its own niche, so I think it's and it's so important as well. If you have a sleep disorder, it affects your entire life. So learning about sleep I find really interesting, and I just like being able to help people. So I just stayed in that industry and have progressed along there. I studied a Bachelor of Biomedical Science, and that gave me, although there's not really too much sleep involved in that degree, I think it gave me those that background in the human body that my employer was looking for. They weren't necessarily looking for explicit knowledge, but they were looking for a person who was open to learning, to learning more. And a lot of the training involved in sleep was actually on the job. So when I took the role as a sleep technician, the first week was just shadowing someone, and I learnt so much in that week. And I guess, that was when you sort of get more specific, and you get that knowledge that is directly related to the job. Yeah. I guess for me it was being proactive during my undergraduate years, finding out what kind of jobs were available. So I took the job as a sleep technician during uni, and obviously that involved an interview and the training, and with that I stuck with that for a good year or so before deciding to take that job selling scientific instrumentation, so just trying to kind of broaden those skills. Overall, the transition wasn't too long. It was probably about 2 years, and I found myself in my current job. But I guess it was just trying to identify what I wanted and chasing down, I guess, the right pathway for that. I think I would have liked to have known that there definitely are more options than medicine or research. I struggled with that a little bit in the first year or two, but knowing that there are options outside of that was, quite a relief in my third year once I started to kind of realise that was the case. The main thing I would say is to network and make friends with not only your lecturers but also other students in all different years as well. That's helpful. So I actually, in one of my subjects, it was involved with other students from all different levels, and that was quite useful because we were doing projects together. And it was actually, I think I was in my second year, and I talked to a third year student, and she was the one who gave me the idea. She said, you should be a sleep technician. They usually take on students who haven't even graduated yet, and there are quite a few jobs out there. So I just kind of started doing my own research into that, and so to this day I actually acknowledge that girl who told me that little bit of advice, she was the one that actually put everything in place for where I am now. So that's something that I would definitely recommend, is just getting to know your fellow students, because everyone's going through the same struggles of trying to figure out where they want to take their degree, and everyone's doing their own research. So to be able to talk to other people about that is a really, really, really good thing. The other thing I would say is to play your strengths. So look at what you personally find interesting and easy as well. Like what are you good at, and go with that. So for me, it was the interpersonal skills side of things. I really wanted to go into a pathway that utilised those skills, and I kind of was looking at medicine and research and just kind of saying, oh look, I don't think that I'm well suited for that. So I acknowledged that earlier on and just tried to find something else. The other thing to add would be to start early on. So put the footwork in place so that the transition is easier for you. If you leave everything till third year, it's going to take longer and be more stressful. Volunteer, put your hand up to volunteer at your local hospital, just as a ward volunteer. I did that at Greenslopes Hospital for a good 6 months or so, and then I took my first job at Greenslopes Hospital as well. I think they really liked that I had already shown an interest there. And it also, for me, that was a wise volunteering opportunity, because it gave me an understanding of whether a hospital was somewhere that I could actually work, gave me exposure to the environment before I even took the job there. So I think volunteering is another thing to do, and just be proactive before you graduate. Another piece of advice would be to have patience and to acknowledge that it might take some time to build into that dream job that you've had in mind. Most employers want at least 1 and 2 years of good solid experience in something that's relevant before they will take you on. So doing those little jobs, as I mentioned before, volunteering where you can, getting as much experience as you can under your belt will help. But I guess to be realistic, you often do need at least 1 or 2 jobs before that dream job will be able to fall in place.